Welcome to 60 Gynae and OBS NCLEX questions. Chapter 1 starts now. Question 1. A client in active labor has a fetal heart rate of 100 beats per minute. What should the nurse do first? A. Document the finding. B. Notify the provider immediately. C. Increase for fluids. D. Turn the client to the left side. Answer is B. Notify the provider immediately. Rational. Normal FHR is 110 to 160. 100 is fetal bradycardia and a sign of fetal distress. No, I will tell you why this is dangerous. Bradycardia can mean cord compression or placental insufficiency and needs immediate intervention. Baby slow equals go fast. Question 2. A postpartum client is 4 hours after a vaginal delivery. Which assessment finding is a priority? A. Lochia rubra, moderate amount. B. Uterus firm at the umbilicus. C. Boggy uterus displaced to the right. D. Perineal discomfort rated 2/10. Answer is C. Boggy uterus displaced to the right. Rational. A boggy displaced uterus means it is not contracting and the bladder is full. This is the #1 cause of postpartum hemorrhage. No, I will tell you why this is dangerous. Uterine atony can cause life-threatening bleeding in minutes. Memory click, boggy equals bleeding. Question 3. A client with preeclampsia is receiving magnesium sulfate. What assessment indicates toxicity and requires immediate action? A. Respiratory rate of 18 and DTRs 2+. B. Urine output of 35 milliliters per hour. C. Respiratory rate of 10 and absent deep tendon reflexes. D. Blood pressure of 140/90s. Answer is C. Respiratory rate of 10 and absent deep tendon reflexes. Rational. Magnesium toxicity causes respiratory depression under 12 and loss of reflexes. No, I will tell you why this is dangerous. This can lead to respiratory arrest. Stop the infusion and give calcium gluconate. Memory click, mag sulfate equals monitor reflexes and respirations. Question 4. A client presents with painless vaginal bleeding in the 3rd trimester. What should the nurse avoid? A. Monitoring vital signs. B. Pelvic or vaginal examination. C. Establishing foreaccess. D. Administering oxygen. Answer is B. Pelvic or vaginal examination. Rational. Any vaginal or pelvic exam can disrupt a placenta previa and cause massive hemorrhage. No, I'll tell you why this is dangerous. Painless bleeding in the 3rd trimester means no exams. Memory click, previa equals pause off. Question 5. A client with abruptio placentae reports abdominal pain and a rigid, board-like uterus. What is the priority? A. Prepare for vaginal delivery. B. Monitor fetal heart rate and prepare for emergency delivery. C. Give ROGAM. D. Encourage rest. Answer is B. Monitor fetal heart rate and prepare for emergency delivery. Rational. Abruption is painful with a rigid uterus and fetal distress. It is a medical emergency. No, I will tell you why this is dangerous. This can cause maternal hemorrhage and fetal hypoxia within minutes. Memory click, abruption equals painful and premature separation. Question 6. A client at 34 weeks gestation has a BP of 160/110. Question 1. 3+ proteinuria and epigastric pain. What is the priority? At. Administer antihypertensive only. B. Prepare for immediate delivery. C. Encourage fluids. D. Schedule a non-stress test. Answer is B. Prepare for immediate delivery. Rational. Severe preeclampsia with HELB signs requires delivery regardless of gestational age. No, I will tell you why this is dangerous. This can progress to eclampsia, stroke, or liver rupture. Severe equals send to delivery. Question 7. A client is Rh negative and delivers an Rh positive infant. What should the nurse administer? A. RhoGAM within 72 hours. B. Oxytocin only. C. Iron supplement. D. Antibiotics. Answer is a RhoGAM within 72 hours. Rationale. RhoGAM prevents maternal antibodies from attacking future Rh-positive fetuses. No, I will tell you why this is dangerous. Without RhoGAM, sensitization causes hemolytic disease in the next pregnancy. Memory click, Rh negative equals RhoGAM. Question 8. A client with hyperemesis gravidarum is at risk for which imbalance? A. Hypernatremia. B. Hypokalemia and metabolic alkalosis. C. Hypercalcemia. D. Respiratory acidosis. Answer is B. Hypokalemia and metabolic alkalosis. Rationale. Severe vomiting causes loss of HCl and potassium. No, I will tell you why this is dangerous. Hypokalemia can cause cardiac arrhythmias. Memory click, puke equals potassium out. Question 9. A client is undergoing a transvaginal ultrasound in the first trimester. What is the priority teaching? A. Arrive with a full bladder. B. Empty bladder before the procedure. C. NPO for 8 hours. D. Sedation will be given. Answer is B. Empty bladder before the procedure. Rationale. Transvaginal ultrasound requires an empty bladder for probe insertion. No, I will tell you why this is dangerous. A full bladder makes the exam painful and inaccurate. Memory click. Transvaginal equals empty bladder. Question 10. A client with gestational diabetes should be taught to monitor for which sign? A. Fetal bradycardia only. B. Excessive fetal growth and polyhydramnios. C. Maternal weight loss. D. Decreased fetal movement only. Answer is B. Excessive fetal growth and polyhydramnios. Rationale. High maternal glucose causes fetal hyperinsulinemia and macrosomia. No, I will tell you why this is dangerous. Macrosomia increases risk for shoulder dystocia and C-section. Memory click, sugar baby equals size. Question 11. A client asks about signs of ovulation. What should the nurse teach? A. Basal body temperature drops. B. Mid-cycle basal body temperature spike. C. Dark, thick cervical mucus. D. Breast tenderness only. Answer is B. Mid-cycle basal body temperature spike. Rationale. Ovulation causes a 0.5 degree spike in BBT that stays high. Cervical mucus becomes clear and stretchy. No, I will tell you why this is dangerous. Misinterpreting signs can lead to failed fertility. Memory click. Spike equals sperm can go. That's it for today's NCLEX question. If this helped you, hit subscribe and turn on the bell icon so you never miss a new question. Remember, 1 minute of learning today could help you save a life tomorrow. Now it's your turn. Comment below and tell me what nursing topic you want me to cover next. And don't go too far. Part 2 is coming next. See you in the next video.